Today I'm working with my pre-medical student again, and she had a great question. She asked me why I have patients jump up and down when they're coming in with abdominal complaints. Hello, my name is Dr. Monica Flores. I'm a pediatrician in South Florida since 2001. And today we're going to be talking about a good belly exam and what things that would prompt me to send a child to the emergency room or to have further workup. So when a child comes in with nausea, vomiting, diarrhea, abdominal pain, one of the biggest things that I have to try to determine is whether or not they have to go to the emergency room. Is there something in their belly that is going to require surgery or is going to require emergent or urgent care? Appendicitis, intussusception, volvulus, any of the many things that can happen to children. And one of the biggest things that I use is whether or not the symptoms are progressive. So if they're vomiting, if today they're vomiting 3 times, tomorrow 13 times, the next day 33 times, if they have pain and it's intermittent but now it's constant, or it's waking me up from sleep, if it's stopping me from doing things, I don't want to play, I don't want to jump, I don't want to run, I cannot eat, then all of those would be signs in the history to say, okay, this child possibly needs a workup. One of the big things during your physical exam is that you want to look for peritoneal signs. That means that whatever is going on in the belly is causing inflammation of things outside of the intestines. And one of the ways to figure that out is by shaking the belly. So in an infant, because they can't stand up, and if I lay them on the table, they're going to start to scream. Many times I'll have the parents hold the baby in the arms and just jump up and down a few times. If that causes the child to scream or cry, or the child seems to be in pain, that would be a reason to go to the emergency room. Children who have severe abdominal pain, who can't stand up, that would be a reason. Or if I ask them to jump and maybe they and they don't want to do it again, that's another reason. If they're already on the table, you can just put your hands on their hip bones and kind of rock their belly back and forth and see if that causes pain, if you see signs of pain on their face. Or you can take your fist and hit the bottom of their foot, and that kind of rocks the belly, and if that causes pain. To me, that's a lot easier than checking for the traditional signs, which is pushing on the belly and then letting go really fast to see if that hurts more or less. One of the biggest things that I use also to determine if the belly pain is something a little more emergent is having the child sit up. If you're feeling the belly and it hurts, and then you have the child sit up, that tenses the abdominal wall muscles. And if it hurts more, I'm pushing on those tense abdominal wall muscles. So more than likely, that pain is musculoskeletal. It's in the muscle itself or in the skin itself. If when I sit up and I'm pushing on those belly muscles, it hurts less, then more likely that pain is on the inside, because those tense muscles prevented me from pushing on the intestines that are on the inside, and that pain is possibly a little bit more dangerous. So hopefully this will help you kind of determine if your child has nausea, vomiting, diarrhea, constipation, any of these symptoms, or belly pain, if that it's a reason to call the doctor, have them checked out in the urgent care or emergency room. Thanks.